Good afternoon. We are here live in studio. Dr. Marco Pelosi III. He is down here in the beautiful Fort Lauderdale area, and he's been training some of the younger surgeons on the techniques of cosmetic gynecology. So, Dr. Pelosi, welcome to the show.
Thanks for having me on.
So, this has been a theme recurring every single year. And how long have you been doing it coming down here to Fort Lauderdale before your meeting this
This
weekend?
is going to be our fifth meeting down in Florida in consecutive years, and our ninth training course on cadavers, cosmetic
And so you get anywhere from 10 to 20 plus. You have this group of people that can log in and view some of the courses as you progress through the different training. Uh, but really because we're talking to these women out here on things that they actually probably never considered, right? So, you know, if they're not happy with their nose, if they're not happy with their chin, if they're not happy with their breast, I think they're pretty well aware that they can go and get these, go to a plastic surgeon and get these fixed. But from a vaginal perspective, they certainly may not be aware that they can actually see someone like yourself that is trained in this art of cosmetic vaginal surgery. So, what would your typical patient show up at your doorstep?
Well, we have several. So the younger patient is concerned sometimes that they shave the genital area and they can see the labia minora protruding out, and they don't like that.
Oh, there you go.
All right. So what they're seeking is a way to reduce the protruding skin, and the treatment for that is called a labiaplasty. And the labiaplasty has been around for a while, but not too many people know about it. Some people are more concerned with that protrusion just because of the way it looks. They're not happy with the visual of the protrusion. Other people find it uncomfortable because once it protrudes, it starts to drag on the clothing or during sports and even during sex. And that skin, once it's being dragged around all the time, it's like wearing a heavy earring. It just starts to drag and get longer and longer,
Okay.
makes the problem worse. To make it worse, the insurance companies don't view reducing this thing, reducing the skin, as a valid treatment. They consider it to be a cosmetic procedure. But if it was a hemorrhoid, certainly it would be covered by insurance.
Right.
So doctors that they normally see don't have it on their list of insurance-approved treatments for these problems of pain and dragging. And they're not trained in it because, well, if it's not on the insurance playbook,
Right.
it doesn't show up on their training in their residency program. So they come out of residency not really too trained about it. They're not going to be talking about it. And as a consequence, the women that go to these doctors aren't going to be aware of it from their traditional doctor. That's one group of women. Other groups, we have the Fit 40 crowd.
Okay.
Those people, they love to get lean and mean. And that affects two areas negatively. When you get lean and mean in your 40s, your face starts to look a little bit older because you lose fat in the face and you can see more lines. At the same time, you lose fat in the labia majora, the larger outer lips, and they look deflated. So everything looks buff and tight in the whole body except when you get to that area, and it drives these people crazy. And they want to put a little bit of fat in there
Okay.
to puff it up. And just like you can transfer fat to the face to puff up the lines you don't like, you can puff up the areas that look deflated down there that you don't like. And the third group would be the moms. These are people who pushed out a baby and the vagina is not quite tight enough for good friction during sex, and they're not happy about it. But they're not quite broken enough down there that a regular gynecologist would say you have a medical condition or a medical problem. They'll just tell you it's a little loose, that's kind of normal after childbirth, deal with it. And they tell them the most we can do is some muscle exercises. Now, we know because we fix these things all the time that these muscles aren't just out of shape, just needing to be conditioned. They're broken. The supports are broken. It's sort of as if you had a broken leg, and I tell you, go to the gym and do some exercise, it'll
Right.
get better.
Right.
It won't get better until you actually fix what's broken. So when we put these supports back together and we tighten these muscles, we're giving them relief of the main problem they had. Now they feel fine during sex. They don't feel loose, and even though their traditional doctor doesn't know about these treatments, they're able to find relief that's actually effective, not just exercising something broken. So I would say that that's the main three populations of people and the three primary groups of problems that we typically see. Now, some people layer this stuff because it blends into aging issues in menopause in general.
Okay.
Because as you get older and you go into menopause, the hormone levels that support all of these areas, so like the fertilizer, the fuel that keeps these areas vital, diminishes. So everything that was a problem is a little bit more magnified. It's like turning up the volume on the negative, and it becomes harder to maintain things. So a lot of people that do these treatments are also very well versed in menopause management, using hormones and other aids to just make the aging process less painful.
Slow it down.
Yeah, slow it down and make the enjoyable things more more enjoyable. And that's a pretty wide scope of women that this touches because everybody's going to go into menopause. About 50 million people are moms.
Right.
Moms coming out every day. So they're all going to be facing these mom-related issues. And so long as removing the hair from the genital area is popular, keeping that area looking nice is going to be something that's high on the to-do list for a lot of women. And for some, it may just be just having waxing from time to time.
Right.
But for others, it's going to be modifying the appearance with the help of some of these procedures that we offer.
So if you're dealing with, let's go back to your first condition, which is the labia
Yeah.
minora majora, but really specifically is especially like teenage girls, right? So they're starting to develop and many times they overdevelop, right? To cause some of those issues that you talk about, which is the pain, sports related, just confidence related, right? So how young do you treat for those young ladies that with that type of condition?
You know what? It's hard to put a number on maturity.
Yep.
Some people are very mature at 14.
Right.
Some people are very mature at 30. But in that gray zone in between, where you have somebody who's not legally an adult and making decisions about her body, it has to be done with the consent of the parents.
Right.
However, the parents are living with this person, and every day they get to see the pain, the discomfort, or the emotional issues that accompany these problems. And I think that if the woman, the young woman, is reasonably mature, she's probably going to make a reasonable decision about being informed about what these procedures can offer, what the risks are, what the benefits are, and what we expect from doing the procedure. If you have a crazy request or a crazy expectation, I don't care what age you are,
Right.
we're never going to achieve it. Whereas if we have a realistic expectation and reasonable person, we're probably going to make them very, very happy. So there's always that selection process and make sure it's a good blend between the doctor and the patient, that they feel comfortable discussing these very delicate issues with that particular person. Because if the chemistry isn't there and there's a problem, now you have two problems. You have a chemistry problem and you have a procedure-related problem, and it makes it tougher to deal with.
But at least it's something that if you're a young lady, there's a solution for you, or most likely there's things that can be done that can assist to deal with this condition, because many people actually aren't familiar that they can go have this type of reduction done, and so I think that's just giving our viewers, our ladies, awareness that there's people like Dr. Pelosi that's out there, and then of course you've trained so many people from around the world. You're in New Jersey. You've got people here that are from overseas along with here in the United States, how would someone know that they graduated your course, right? How would is there something that they can go to your website? They can see that hey, they've been specifically trained in this because it is at the end of the day, it's art and something they want to that they're going to live with, and they want to be specially trained.
Well, yeah, you can go on their websites and ask them if they've been trained by the ISCG, which is the training courses that we've been offering for over 20 years now.
Okay.
If they were trained elsewhere, first ask to see the quality of their work in before and afters. And if they're doing quality work for many years, they should have many before and afters to show you. If they don't, that's sort of a red flag. Why don't you have any pictures? What are you hiding, or what lack of experience are you not telling me about? Um, and if you like the work, then it's a good idea to reach out, do a virtual consult, do a Zoom with them, just to see if the chemistry is there.
Right.
If you don't like them, if they're a jerk, you might not want to have it done by a jerk who happens to be good, because if there's a problem or a communication that you want to make with these people, it just makes it more problematic. But I would say if you don't like the work, I don't care what degree is on your wall. You've already seen what they can do for you. You don't like it, pick another one. So I would recommend always doing a couple, at least 3 or 4 consults with 3 or 4 people, just to see what the differences are,
Sure.
and just make a good decision based on not just one. Uh, and even if your best friend had a great result with somebody,
Right.
all right, you don't know if that's luck. You don't know if your friend has a particular shape and size of something that was operated that was in that person's, you know, field of expertise, and yours is a little bit outside, so your result might not be the same. So just do your homework. Uh, Use your friends' recommendations as a guide. Just put that person on the list, but don't limit your list to just the people that just come up first in your journey.
Great advice for all these ladies out there. Do your homework. Make sure that they're credentialed and that they have their portfolio of their cosmetic surgery that they've been doing. You certainly do. Check out your website. What's your website so that we can let all the viewers know?
My easiest one is
The easiest one.
drmarcopelosi.com. The doctor is spelled DR.
There you go.
Marco is spelled like Marco Polo, and Pelosi is spelled like Nancy Pelosi. drmarcopelosi.com. And I have links to all of my social media, all of my websites there. I even have a podcast, and all of that is related to these topics and other aesthetic topics that people who want to improve their appearance and the way they feel about themselves are looking for.
Well, we thank you for stopping in the studio, and best of luck with the conference and finishing up your training, and definitely would love to have you back here in the future.
Well, thanks for having me on. It was a pleasure to spend some time here.
Okay, thanks everybody.